mother, congratulations on your pregnancy. This is a maternal and child health record book for you and your child. Please bring this book along with you anytime you visit the health facility. The Maternal and Child Health Record Book, MCH Record Book, is a home-based health record for mothers, newborns, and children, which contains essential health records and information to promote and maintain their health and their family's health. It has been developed to be used by family and health workers. In the last few decades, Ghana has been utilizing two separate home-based record books: maternal health records for pregnant women and mothers, and child health records for children. Although useful for record keeping, those books were presented separately and did not provide the essential linkage for the continuum of care from pregnancy to age 5. To fill the gaps of maternal and child health record services with better coverage of continuum of care, COC, the Ministry of Health of Ghana and Ghana Health Service developed a new combined maternal and child health record book with technical and financial support from Japan International Cooperation Agency, JICA. This new book contains additional information on the nutrition of the pregnant woman and the child and enhanced illustration to promote good health for women and children. The effort to develop the MCH record book started in early 2016 before the project commenced. Under the leadership of GHS and JICA, a series of meetings and workshops with key stakeholders were conducted to develop a conceptual framework which defined the essential records and information to be included in the new MCH record book. As part of the process of development, GHS and JICA conducted a pre-test of the draft book in 2016, after which the use of the book was piloted in 3 regions: Upper West, Ashanti, and Central in 2017. The MCH record book was finalized for national distribution in 2018. Her Excellency Samira Bawumia, the Second Lady of Ghana, handed over the first copies of the MCH record book to pregnant women on 2nd March 2018 in the Central region of Ghana. The national rollout of the new combined MCH record book followed immediately. The MCH record book has been distributed and is currently used in more than 90% of health facilities in Ghana. The book has been accepted well by mothers and health workers and the community at large.
The introduction of the maternal and child health record book in Ghana, with support from JICA, has significantly improved the way health service is delivered. It has improved outcomes, and most importantly, has introduced very critical services that is needed for both the mother and the child. It combines a lot of issues: immunization, nutrition services and counseling, measurement of growth, including the introduction of length measurement, which was hitherto not done in the country. And this has significantly raised the awareness of parents and also the enthusiasm of the community in demanding that every child must have a combined record book.
The book promotes continuity of the services for a mother and child from pregnancy until the child attains age 5 in health facilities at all levels, at home and in the community. The MCH record book is thus a platform that links all stakeholders and services for maternal and child health and nutrition.
The Maternal and Child Health Record Book is a very useful tool for providing services to pregnant women and children. It combines the health of the mother from pregnancy through delivery till childbirth with the records of the child from birth till the age of 5. For child health, there is a lot of impact on what happens with the child through pregnancy and delivery. And sometimes looking for records on pregnancy and delivery becomes a problem when they are in separate books. But the combination gives us a good history so that it's easy to trace and find out if there is anything happening to the child that has been impacted on from pregnancy. Developing the book and implementing it has brought together service providers from the maternal health side with the child health side. It has engendered dialogue, which ends the better for children in Ghana.
The project for improving continuum of care, COC, for mothers and children through the introduction of combined MCH record book called MCH Record Book Project started in April 2018 in collaboration with Ministry of Health, Ghana Health Service, and Japan International Cooperation Agency, JICA.
The Maternal and Child Health Record Book promotes health and nutrition for mothers, children, and entire family members, and support mothers and family members to take good care of themselves and their children at home. The book is also useful for healthcare providers to provide MCH and nutrition services with good quality. So we started training of healthcare providers on how to use MCH record book effectively for their services. Our approach is called Dear Mother approach. We like women to understand the message clearly and the practices at home. JICA continues to support nutrition and health of women and children and an entire family in Ghana as the entrance of the universal health coverage. And we hope that Ghana's experiences to be sustained and expanded and shared with other partner countries for SDGs.
The book contains the health record of a mother and her child, as well as health and nutrition messages. It begins with a Dear Mother message, which healthcare providers use to introduce the book to a pregnant woman in a respectful manner. It has a Continuum of Care card, COC card, to motivate and remind mothers to access all relevant services. The health worker gives a star stamp on the COC card upon every visit, congratulates and encourages the mother to complete all COC services. The book also has various health and nutrition messages with illustrations to encourage mothers and family at large to understand and appreciate its content in the comfort of their homes. It also emphasizes the important role of male partners and the family to support pregnant women and child care. The book is color-coded to improve the work efficiency of health workers.
With the introduction of the book, today across the country, we have health workers that use the book to engage caregivers in a systematic and stepwise process that ensures that the health worker gets information on challenges that the individual mother and the entire household is grappling with. And through that engagement, they analyze the problem and together they negotiate a solution. And this is really improving the recommended nutrition and health practices that we believe will contribute ultimately to improving recommended actions such as early initiation of breastfeeding, exclusive breastfeeding, and improving the complementary feeding practices across the country. And for us, this is really exciting, and we believe ultimately it's going to contribute to achieving the Sustainable Development Goal and push the country forward.
3.3 million copies of the MCH record book have been printed in the past 4 years with partners. Ghana Health Service and JICA also developed and printed 30,200 user guides and other training materials and distributed to all health facilities. From 2018 to 2021, JICA procured a total of 1.9 million MCH record books to Ghana. To ensure capacity building nationwide, the project supported Ghana Health Service to train 939 facilitators in all districts of the country. The core team of regional and district level facilitators served as resource persons conducting training, orientation, mentoring, or on-the-job coaching and supervision to health workers in their respective facilities, districts, and regions. To date, the project has supported training for 1,642 health workers across the country. Training on the Maternal and Child Health Record Book is currently a 4-day program. Training methods include a series of lectures, various hand-on activities, and field practices at hospitals and health centers. During training, participants learn how to introduce the MCH record book, how to fill the book, how to measure weight, length, and height, and how to interpret the nutritional status and growth, as well as how to conduct nutrition counseling and respectful care. Participants learn how to conduct nutrition counseling with locally available foods. Field practice sessions are also conducted for participants to enable them to practice the requisite skills. The training package consists of a user guide, trainer's guide, participant's guide, job aid flip chart, and operational guide on nutritional counseling services and respectful care.
We wanted the MCH record book to be user-friendly for both healthcare providers and mothers. So we took some time to test the book with healthcare providers, mothers, and family members in many health facilities and in many communities. We also spent some time for training healthcare providers. Healthcare providers were good at providing health education, but they sometimes had difficulty doing health counseling effectively. So we trained healthcare providers to use MCH record book with simple and easy to understand language for women. And as a result, more than 70% of mothers said that they felt free to ask a question, and they remember what healthcare provider said during the counseling. So we believe that MCH record book together with the Dear Mother approach can build the good understanding and good communication between healthcare provider and mother and build a solid foundation for providing quality of care.
As part of activities to roll out the use of the books in all regions, sensitization meetings were conducted in all regions in 2018. Participants included key stakeholders such as traditional and religious leaders, representatives of the Regional Coordinating Council, health training institutions, teaching and regional hospitals, National Health Insurance Authority, Births and Deaths Registry, the media, and district directors. This was to ensure that the book was accepted and promoted by all the relevant stakeholders. Ghana Health Service selected 11 districts in Ashanti region as model districts for the rollout of the MCH record book. Key activities conducted in these model districts with support from the project included training, regular mentoring, coaching and supportive visits to 990 health workers within the selected districts. Additionally, the project donated some equipment such as weighing scales, height and length boards, and hemoglobin measuring equipment to the 11 districts to ensure smooth delivery of all the recommended services. Additional MCH record books were also procured and distributed in these selected districts to avert any shortages.
On behalf of Ghana Health Service, I would like to thank JICA for this partnership in the Maternal and Child Health Record Book project. It has helped us a lot because previously we realized that because there were data inadequacies and data gaps, so we're not getting the adequate information so as to help the mothers during antenatal clinics. And I believe that this project has come a long way to support us. During the capacity building, we train our nurses on nutrition counseling and then on how to support the mothers, that is mother support. And then we provided them with the maternal and child health record books. In addition to that, there were other logistics and equipment that were provided, all with the support of JICA. And then we strengthened monitoring and then support visit.
During this monitoring and supervision, regional and district facilitators got the opportunity to coach frontline staff on nutrition counseling services amongst others and observe how correctly and appropriately they fill the MCH RB. I must say that during this supervision, we saw that mothers had books that had the Continuum of Care page appropriately filled. The star stamp had been given right from ANC through PNC, through delivery to CWC. And when mothers deliver and we call the babies star babies, it excites them so much and they are just so happy to have babies that are called star babies. If we continue this way, I'm sure that our aim of ensuring that all women or mothers and children receiving continuum of care would be achieved. We want to thank JICA for their support.
After the training on the Maternal and Child Health Record Book, we realized that the continuum of care services had increased. A mother comes in at a registration at the antenatal and the services are provided. Then postnatal care services are provided with the MCH record books. Then from which she continues with the same book to the CWC. With the MCH RB, at every stage, you can go back and refer to the services that were provided. We also realized that the HV of our mothers have improved very tremendously as a result of the timely nutrition counseling provided during the antenatal. Then also mothers have gained the requisite knowledge and skills with regards to the feeding practices of their children as a result of the nutrition counseling that has been incorporated into our routine maternal and child health services.
And the way I buy Mediajupa because of a choir almost fast on your fa and clano at the deal. Next year, you best be a mobile fruits and the Adrian Mediaji. And last year, I wore you for no CB and near Balmunia Casare and Clana Kama and manager home pa. My idea and I set an international bachelor of my idea, don't master pan, I mean slow. Yes, she had out to me, the way of Blania home, planning years and I'm being. Amaye na ye nkware na mo aye hu se ye nso ye ba na ekui ye do masipanya mi hira o de work
me ba no na mi hu enuane a ebe ma na pomaye de ba ye ne ya kire me o mehu se mi wo nuane ekuom enan a me de ma akra na odidi a na pombe ye de ama ni mu duro nso aye kese.
Happiness is an incredible happening in humans. Wherever it is lacking, nothing works. And this project echoed that very amply among family members to be happy because they have, from time to time, anytime a milestone is achieved for the baby or for the child, it is a time for celebration. It is the same way when a milestone is not achieved, then they know something is not going on right. And then they refer to the steps. The steps are even provided in the book where they can go and follow. What do we do? Because the risk assessment for danger, they look out for danger signs. And if they find that probably that is a challenge, they are always able to report early. and then that helped the child to celebrate their 5th birthday, so that we avoid this infant death, child death that usually come unaware.
As a follow-up to the training, the project supported Ghana Health Service to conduct mentoring and supportive supervision in all regions in more than 800 health facilities nationwide from 2019 to 2021. Findings indicated that most health workers use the MCH record book effectively, started measurement of the length of a child, kept the records of mothers and babies at birth, and conducted nutrition counseling services with respect and privacy. Comparatively, the performance in the 11 model districts were higher than in the remaining parts of the country. For the sustainability of the Maternal and Child Health Record Book Program, Ghana Health Service and JICA developed a management guide with the support of key stakeholders in the health sector, such as Christian Health Association of Ghana, Ghana Association of Quasi-Government Health Institutions, Society of Private Medical and Dental Practitioners, WHO, and UNICEF. The management guide serves as a reference guide for the management and administration of the Maternal and Child Health Record Book at all levels. It contains guidance on key issues such as copyright, printing by third parties, distribution policy, and quality control.
Together with other stakeholders, we have to find very sustainable means of making sure that the yearly over 1 million books that we need are constantly supplied. Because you see, the danger is that if we don't get these supplied and there's a break, then definitely in quotes we've lost some of the mothers and children of this country because they don't have books and we don't document. Documentation goes both ways, both for the client and for the service, so that this is something in which you will use to cross-check each other. Because how happy you would find a very happy family together, the mother and father and the children living through the books and then actually getting themselves educated. It is not just maybe for the health worker, but the most important thing is that the community, and the book has been written in such a simple way that even without knowing the complexities of the English language, at least the pictorial representations have been able to make sure that basically all the mothers and fathers are able to follow through the book. That is the very good thing about the book.
Ghana's experience with the national rollout of the MCH record book has created opportunities for learning for other countries. A team from Sierra Leone visited Ghana to learn from Ghana's experiences in implementing and scaling up the use of the books nationwide in February 2019. Ghana's experience in the national rollout of the book has also been presented at international conferences such as the International Conference of MCH Handbook and the International Pediatric Association Congress.
As a midwife, the new Maternal and Child Health book, which is comprehensive, which contains all the necessary information that a midwife or a health worker will need to care for a pregnant woman till she has delivered, and even continuing the weighing or the child welfare clinic. Using the book has made my work very easy because it directs you to collect all the data, the history that you need to care for the mother during antenatal, labor and delivery. So it's of a good help to us. It has all the information. It's client friendly, it's midwife friendly, and it's in fact family friendly. My first day of giving this new book to a mother, the mother really appreciated it. Upon taking her through what the book contains and how she will be using it, she was appreciative. She really thanked me for giving the new book to her.
All statements and feedback indicate that the Maternal and Child Health Record Book is indeed a vital tool for the health and well-being of mothers, children, and entire family members.
Book no mande mama na me de ko fie. Ti me de ko ye no. Nneema e wo book nim pictures ne saa nneɛma no nti ma at least nduane a ɛwɔ book no mu a kyerɛ sɛ ɔpemfo a wɔsɔ wodi na akwadaa no nya ahoɔden no ma me sua bi wɔ book no mu nti ɛno na medi na mehwɛ nneɛma no ɛwɔ mu no ne de wo a asa wonyem na wo ho yɛ wo ɛwɔ sɛ wokɔ hospital a wobɛkɔ mekɔ antinenta ɛno na mede kɔɔyɛ mekɔwoyɛ ɛno na mede kɔɔyɛ mewu wieyɛ no ɛno na me use yɛ meba wenyi a ɛno anso na me use up till now ti book ni de mfa so was papa ɛyɛ aboa me pa ɛna even me kunka na ni age book no say it's like ono ni ha but our me book just oh wow book yi ɛyɛ fine ɔsɛ me kɔ wenyi na nneɛma like sɛ ne yewu akola no ba ɔsɛ o twa kyerɛ me yɛn say nneɛma aduane ɛwɔ ɔsɛ o kɔ aduane yɛayɛ we mu nti we mu na wɔsɛ wudi ɛne adeɛ nti book ni de aboa me bebree so wɔn fa so papa
Ghana Health Service will continue to engage with partners across the country to make sure that every mother and every child has the MCH record book and receive the Quality Continuum of Care.